For mare follicular aspiration, we utilize an ultrasound, a vacuum pump that controls suction of the follicle, and a probe and needle guide holder. This black piece is attached to the ultrasound and contains the needle guide, where the aspiration needle will be placed in. In the tip, it contains the ultrasound transducer. The vacuum pump is controlled by a pedal. As soon as the mare gets in the stock, the first thing we'll do is to wrap her tail utilizing a plastic tail bag and white tape. We do that to prevent contamination and the tail being in the way during the procedure. After we wrap her tail, we'll tie it up using bungee cords to keep it out of the way. The next step is then to place a couple of 4x4 gauzes in the mare's vestibule to prevent any piece of manure getting inside her vestibule while she's being cleaned out. The veterinarian then cleans the mare rectum to prevent any manure to be in the way during the procedure. Then we proceed to scrub the mare's perineum with betadine scrub solution. We then rinse her perineum and repeat these steps at least 3 times. The next step is to place an urinary catheter in the mare. This step is not required for the procedure of follicular aspiration, but because the whole process of aspirating pre-ovulatory and secondary follicles lasts from 30 to 45 minutes, it is recommended to have an urinary catheter in the mare's urethra so she doesn't urinate during the procedure. After the catheter is inserted in the external orifice of the mare's urethra, it is then fixed to the stalks so it's not in the way during the procedure. The mare is then given sedation intravenously. For this procedure, we normally utilize xylazine, ordetomidine, and butorphanol. We also normally give the mare's buscopan intravenously to prevent rectal smooth muscle contraction during the procedure. While the mare is being prepped and sedated, an assistant will prepare the aspiration needle, which is hooked to a sterile plastic disposable bottle. The needles we utilize for follicular aspirations in mares are 12-gauge double lumen needles. And the reason the needle has to be double lumen is because one lumen sucks fluid out of the follicle and into that plastic bottle, while the other lumen brings fluid into the follicle to rinse it. That is also why there are 2 lines attached to the needle, one inflow and one outflow. The veterinarian who is performing the aspiration then grabs the needle, and the assistant will follow him to the aspiration room carrying the bottle and the syringe attached to the needle. The veterinarian then places the needle into the needle guide. Some sterile lube is then put on the ultrasound transducer and also throughout the probe. The veterinarian then places the probe into the mare's vagina, aiming the tip of the probe to the side of the cervix ipsilateral to the ovary he's aspirating first. In this case, the ovary that has the preovulatory follicle. The veterinarian then goes in rectally and searches for the ovary to position it against the transducer of the probe. After the ovary that has the preovulatory follicle is found, flipped, and positioned against the probe, the veterinarian will search for the best position to poke the preovulatory follicle. In the ultrasound image, you can see the follicles, which are the black circles. They appear black in the image for being filled with clear fluid and thus hypoechogenic in the ultrasound. The preovulatory follicle is the larger one, in this case around 40 millimeters, but you can also see some smaller follicles nearby. When the pre-op follicle is in a good position, the veterinarian will advance the needle and poke the follicle. The assistant will then start suction from the vacuum pump and follicular fluid will be aspirated to the bottle. You can see the follicle losing its fluid and getting smaller. When almost all the fluid is aspirated out of the follicle, that's when the assistant will start flushing. So we start adding media with the syringe. Here we can see the aspiration bottle filled with follicular fluid, which is this yellow liquid, and the assistant injecting rinse or flush media into the follicle. So really rinsing the inside of the follicle. The assistant will also stop suction and just inject fluid into the follicle. So here we can see the follicle being refilled with fluid and we can see some cells floating around. So that's how we harvest the granulosa cells and hopefully the oocyte from the walls of the follicle. The veterinarian will rotate and manipulate the needle to scrape the walls of the follicle. He will also manipulate and massage the follicle with the hand that is in the mare rectally to again free the cells from the follicular wall. By doing all this manipulation, we'll sometimes and normally get some blood especially from the dominant preovulatory follicles, and that is normal because the follicles are very vascular, especially the preovulatory follicles. The assistant will continue to inject fluid into the follicle and suck fluid out of the follicle with the vacuum pump, and the veterinarian will continue to massage and scrape the follicular walls until the aspiration process is complete. When done with that follicle, the veterinarian removes the needle out of the follicle and the assistants will switch aspiration bottles, placing a new empty bottle in the system to aspirate the secondary follicles. The bottle containing the preovulatory aspirate is placed in a warming incubator to maintain body temperature, as the preovulatory oocyte is very sensitive to temperature changes. The veterinarian will reposition the ovary and search for the better position to poke a secondary follicle. When in a good position, he will advance the needle and poke the secondary follicle. Because the granulosa cells are more compact and more attached to the follicular wall in the smaller follicles, the assistant will fill the whole follicle several times, injecting fluid with enough pressure to remove the cells from the wall. The veterinarian will also rotate and manipulate the probe and the needle a lot more than with the preovulatory follicle. When done with one follicle, the veterinarian will again reposition the ovary and search for other secondary follicles to poke and aspirate. When the whole aspiration procedure is complete, the first step in the lab is to search for the oocyte from the preovulatory follicle. Because it is temperature sensitive, all the plates utilized to pour the contents of the aspiration bottle are kept on heating stages set to body temperature. The aspirate from the preovulatory follicle will commonly be bloody, and that makes it easier to find the cumulus oocyte complex, as the cumulus cells will be expanded and light in color, as we can see here in this dish. After we find the oocyte, we'll move it to a dish with benchtop media to rinse it. We normally utilize 1 ml syringes with a straw connector and 0.25 ml straws to move the cumulus oocyte complex, as the cumulus cell mass is large and we want to avoid damaging it. So we'll first rinse the straw with the rinse media, then find the oocyte and move it using the straw to the rinse dish. Here you can see how large the cumulus cell mass is surrounding the oocyte. The next step is then to move the cumulus oocyte complex to the maturation media that is previously equilibrated in 7% CO2. We'll again rinse the straw first in the maturation media and then move the cumulus oocyte complex utilizing the same straw. The oocyte will then remain in maturation media in the incubator for around 20 hours before it is sperm injected by ICSI. To search for immature oocytes from the secondary follicles, we'll typically filter the aspirate fluid utilizing embryo collection filters. We do that to reduce the total volume to search through. We'll then search for the immature oocytes in the filter under the microscope. Here you can see how different and compact the cumulus cells are in the immature oocytes. Like we did with the preovulatory oocyte, we'll also rinse the immature oocytes in benchtop rinse media. But in this case, we can utilize a regular pipetter to manipulate the immature oocytes. The immature oocytes are normally held overnight at room temperature in holding medium and moved to maturation media with hormones the following morning. They will be in maturation for 30 hours before they can be sperm injected.